everyone. This is Jignasha Shah from Warren County Public Health. We are here with our podcast, Just for the Health of It. And we have with us Ms. Laura Lee Tucker. She is the program coordinator at the Health Promotion Center at Glens Falls Hospital. Welcome, Ms. Tucker.
Oh, thank you so much. Thank you for having me. It's my pleasure.
Thank you so much for taking the time to speak with us today about our topic of cervical health and HPV vaccine.
Oh, I appreciate it.
So before we get started, would you like to say something about yourself?
Sure. So my name is Laura Lee Tucker, and I've been a health educator in various capacities for over 20 years now at the local and state level. My journey started in St. Lawrence County, working with young people and at-risk youth with adventure-based counseling. And then I ended up coming back down to, I'm a hometown girl. Warren County I was born and raised in Glens Falls. So it was nice to come back into the capital region, where I worked in HIV prevention and testing, STD work, down in Albany. And now I'm back in Warren, Washington, Saratoga counties. So I spent 12 years as Washington County health educator, where I believe I was quite a strong advocate for everyone. I worked in all populations from age 0 to adults. So my career in health education has been very exciting. I'm very passionate about my work in prevention, and it's come full circle. I'm back with the working in collaboration and partnering with our communities as a grateful member of the Health Promotion Center at Glens Falls Hospital, and as Cancer Prevention and Actions Program Coordinator for Warren, Washington, Saratoga counties. So I've been in this role for about a year now, and I couldn't be happier. I really love my job.
Yeah, you have such a wide, varied experience, and I mean, like, it's phenomenal. That's good, and I'm glad you're here with us today.
Well, I appreciate it. I appreciate the opportunity.
Absolutely. So yeah, let's get started with our topic of discussion, which is cervical health and HPV vaccine. As you know, January is Cervical Health Awareness Month, and that is one of our main reasons to do this podcast. So from my research, what I've known with Warren County numbers that were out there from the New York State, the incidence and mortality reports is about 1.2 cases annually, which is about 2.4 per 100,000 people. So what have you been seeing or hearing related to cervical cancer numbers in the community?
Well, you're right on target with your numbers overall. You know, HPV or human papillomavirus, it affects 13 million people in the U.S. each year, and that's all genders, and that's including our teens. Many people are not aware of it. But 1 in 4 people are infected with HPV in their lifetime. Many people are not experiencing the symptoms. Therefore, they don't know they even have it, and they can transmit it to others. And right now we're looking at New York State, 2,800 people are diagnosed with cancers related to HPV. Unfortunately, right now, the numbers are looking approximately 4,000 women are losing their battle each year. But there is some good news with prevention efforts and local resources within our area. So I believe we're on our way to reducing cancer outcomes.
Yeah, and I totally agree with you because I mean, yes, cervical cancer is one type of the cancers that is caused through HPV vaccine, HPV virus, and there are multiple other types of cancer that are caused through it too. So yes, absolutely, to have an HPV vaccine and to advocate for it would be the key point to help bring that awareness.
Absolutely.
So what do you think are the causes of having so many infections or so many increased level of cancer in the community?
Well, I think some of our biggest barriers in our communities are definitely a lack of awareness that of HPV, that it's one of the most common diagnosed STDs. And I think that there is a lack of awareness in the male population as well, that it affects all genders, right? We think about I think a lot of people associate HPV related cancer as a female problem, or someone with the cervix, right? So I think approaching this our prevention efforts as and making it an all gender problem. I think we could do a better job about that. I think there's still a lot of stigma associated with HPV, especially within young people, and adults saying, the stigma of it's not going to affect me, it's not going to affect my child, not my child, right? And I think we have a lot of I think one more barrier that is affecting our communities is the lack of provider recommendation. I think we could do I think our health providers are instrumental in being that authoritative voice to help with our prevention efforts and recommending HPV vaccine to their patients and educating families or the decision makers within the home.
I again, as I said, I totally agree with you. So some of the numbers that I came across for HPV vaccination among our 13-year-old youths, it was about 29.58%. And I mean, New York State is at 24.5%. I mean, both the numbers are low. It's still, the state is lower than what we see at Warren County. So, I mean, there is some form of discrepancy that is happening, and whether you can say like lack of communication that is happening in the community among the providers and the families about that.
Yeah.
So the next question would be, what do you think are some of the initiatives that you have worked in the past or are in works currently to help bring these numbers back? I mean, to like add more vaccination numbers in the community.
Well, I think some things that we need to do as a whole within our communities is change our paradigm of thinking when it comes to HPV and removing that stigma. We're talking about cancer prevention here. So if we could just work towards changing our mindset, remove that stigma, and just focus on the fact that we're preventing cancer. And if as a parent myself, I know I want what's best for my children. I want to, in my home, we talk about tough topics like sexually transmitted diseases. We talk about HPV. We talk about what we can do to prevent infections, and my children are vaccinated. So as a parent, I think we play an instrumental role. I think increasing our awareness within our communities, I think, and consistent messaging within those communities. So whether we have those conversations at home, we're having them at school, we're having them with our healthcare providers. Now we're talking about healthcare providers, whether it's our primary care, our pediatricians, our dentists. Now pharmacies are able to provide vaccinations. And of course, within our local health departments, we all play an instrumental role within that messaging piece, and keeping that consistent and taking the stigma associated with the topic and just focusing on that cancer prevention piece. I think it's very important. And I think with that, in addition to the resources available in our communities, like Cancer Prevention in Action. Cancer Prevention in Action is a grant that has is in its year. We're just finishing our year 3, and we were just approved for year 4. So I'm very excited
Congratulations.
about that. Yes. So more there's definitely enough work to do, and of course, as you can see, I really love my role within this grant, and so I'm very excited about continuing on the work. So Cancer Prevention in Action is a grant that uses a policy, systems, and environmental change approach to address skin cancer outcomes, to reduce skin cancer outcomes, and uses education to promote the HPV vaccine as safe and effective cancer prevention. So we partner with local health departments, the Cancer Services Program at Glens Falls Hospital, the New York State HPV Coalition, we're a member of and work with them regularly. And there are a lot of initiatives out there, such as the Start at 9 campaign, with that we're promoting, and work with the New York State Dental Association. And so those partnerships, I'm sure you know, being in public health, we aren't successful without partnerships and collaborations, right? So the resources and initiatives out there are definitely available, and we just want to make sure that that our communities are aware of those resources, and that they're and that we can really make a difference and reduce cancer outcomes, specifically with HPV, and promoting the HPV vaccine as safe and effective cancer prevention. 15 years of research, right? So
I can't agree more. Would you like to elaborate? I know you mentioned Start at 9 campaign. Would you like to elaborate a little bit of that information for our listeners?
yeah, so the Start at 9 campaign is a campaign for communities, specifically the healthcare communities, to recommend the HPV vaccine as early as age 9. It's safe and effective, proven safe and effective, the HPV vaccine, to be administered to patients as early as age 9. And the hope is that with this, starting young people at the age of 9 will help increase vaccine completion rates or initiation rates. As we were talking earlier, the vaccine rates in our areas are very low. And so our goal with Cancer Prevention in Action is to partner with New York State HPV Coalition and promote the Start at 9 campaign to increase those vax rates. At least, we have data on initiation and completion rates, and compared to locally, nearly, the data is currently showing that even though that the HPV vaccine can prevent 90% of HPV related cancers, nearly half of the adolescents in New York State are not getting vaccinated as recommended. Now we know that the pandemic has caused a little pause in our prevention worlds. But right now, only 57% of New York State adolescents aged 13 to 17 have completed the HPV vaccine. And that's the most updated data that we have. And this data is compared to the Healthy People 2030 target. So that target is 80% of adolescents have received the recommended doses of the HPV vaccine. Now, in comparison to that 80, or to the Healthy People 2030 target, New York State average right now, and this excludes New York City, the initiation rates overall for New York State, 62.4% for initiating or getting that first dose, and then the completion rate is 52.8%. I also have data specific to my grant focus areas of Saratoga, Warren, and Washington County. And we have some work to do. We have some work to do.
Definitely. That is for sure. We definitely have some work to do with our numbers being less than 30% for vaccination. There is a lot of work that needs to be done to bring about that.
And we can do it. We can work together. Like I said, we have some strong champions in our corners, in our communities. And we just need to rally the troops, right?
Absolutely. And with that being said, how can Warren County Public Health play a role in helping in whatever way the county can be of help?
Oh my goodness. We'll continue to be champions. I love local health department. I loved working in collaboration with Warren County. Warren County, we have a great history together as in regard to collaborating and coalitions and everything. We've done some great work together. Just knowledge is power. It's so powerful, and continue to collaborate, partner, continue to educate the communities like you are, and provide healthcare services within our communities, whether it's immunization clinics, well clinics, the clinic piece and the education that you do. You are out and about in the community. So continue to do that great work and continue just to be that incredible champion and resource within our communities, all our communities.
Yeah, thank you so much for that. I mean, yes, there is day in and day out, we will keep working towards it. And if there is ever a time where you need us to be, again, not that we're not there, we are right there, but yeah, you know where to find us. So.
Oh, I know where to find you.
Before we end our discussion, would you like to say something as a tip or anything else to add to the conversation that we have been having?
Well, I'm very thankful for this opportunity to be able to share on your podcast about January being Cervical Cancer Awareness Month. I think it's so important to drive home the messages that there are resources in the community that we can utilize to reduce cervical cancer rates and HPV related cancer rates. One of which is taking advantage of those opportunities to be screened, having your regular screenings, and knowing that if you need to have screenings, there are resources out there. You can reach out to the Cancer Services Program at Glens Falls Hospital. They have a program that assists men and women to obtain cervical, breast, and colorectal screenings at a low or no cost. So that is a beautiful program within Glens Falls Hospital that the communities can utilize to increase increase access to screenings. As far as our communities, we can take action against cancer with cancer prevention and action. We can reduce HPV transmission rates and cancer outcomes within our communities through partnerships. HPV, as we know, causes 6 types of cancers, but there is a safe and effective prevention method with the HPV vaccine that saves lives. Cancer screening saves lives, right? So anyone that would like to learn more about cancer prevention and action at Glens Falls Hospital's Health Promotion Center, please feel free to reach out to me personally at 518-926-5906, or you can email me at ltucker@glensfallshosp.org. We offer the grant offers unique opportunities to schools, partnership opportunities to schools, child care providers, outdoor work sites and recreation departments, higher ed, and healthcare providers in Saratoga, Washington, and Warren County. And we use policy systems and environmental change approaches to support sustainable evidence-based strategies to decrease skin cancer rates and outcomes within our communities, as well as use education and promote the HPV vaccine is safe and effective cancer prevention in order to reduce those HPV related cancer outcomes.
No, thank you so much, everyone. That is Ms. Laura Lee Tucker, the program coordinator at Health Promotion Center at Glens Falls Hospital. And I'm your host, Ignacia Shah, Public Health Program Coordinator at Warren County Public Health, signing off. Thank you for listening.
Thank you so much.
Thank you.